Welcome back to the deep dive. You know, it feels like sometimes you're just drowning in medical information, right? Or maybe you walk out of the doctor's office a bit fuzzy on what exactly you've been prescribed.
Absolutely.
So today we're going to cut through all that noise. We're tackling the everyday medications you're most likely to see in primary care.
Yeah.
Think of it like getting the inside scoop on your medicine cabinet. We're going beyond just the name on the bottle. And we're using a great source today, this really detailed top 10 meds in primary care tip sheet. It's packed with the stuff you actually need to know.
Exactly. And, these aren't some obscure drugs we're talking about. They're the real workhorses.
Right.
They treat the things lots of us deal with: high blood pressure, diabetes, infections, even things like anxiety or depression.
Yeah, the common stuff.
Totally. And understanding them, even just the key points. It's not about, becoming a pharmacist overnight.
No.
It's really about feeling more in control of your own health conversations. Knowing these little nuggets, what it's for, the big side effects, what it interacts with, it genuinely empowers you, the listener.
So you can actually understand the why behind it.
Precisely. Why it matters, what you need to keep an eye on.
Okay, let's dive in then. First up, the cardiovascular and metabolic toolkit. We're talking heart protection, blood sugar management,
Big ones.
and right at the top, atorvastatin. Most people probably know it as Lipitor.
Very common.
This is a statin, a real powerhouse for lowering cardiovascular risk. Usually prescribed if your risk is pretty high, maybe you've had an event already, or your LDL, that's the bad cholesterol, is way up there.
Right, or for certain groups, like people aged 40, 75 with diabetes, or even without diabetes if their risk score is high enough.
So for someone on atorvastatin, what are the absolute must-knows? Especially things like interactions, maybe stuff that flies under the radar.
Okay, yeah, that's a crucial part. So a really important prescriber pearl with atorvastatin is this risk of myopathy, that's muscle pain or weakness.
Okay.
And what's surprising is how it can be triggered by interacting with things you might not even think about.
Like what?
Well, they're called CYP3A4 inhibitors. Bit of a mouthful, I know.
Yeah.
But basically, they mess with how your liver processes the drug. And we're talking about things like certain antifungal meds, but also everyday stuff like grapefruit juice.
Wow, grapefruit juice.
Yeah, and St. John's wort, even some common antibiotics called macrolides.
Okay, that's huge. So you really need to tell your doctor everything you're taking.
Everything. Supplements, herbs, the lot. It's critical. And also, standard practice is getting a baseline liver function test before starting and repeating it if you notice things like unusual tiredness or yellowing of the skin, jaundice.
Got it. That interaction piece is key. Are there other sort of surprising interactions like that with these common meds we should flag?
Oh, definitely. We'll hit more as we go. But maybe let's shift to blood pressure now.
Good idea.
Because amlodipine, or Norvasc, and lisinopril, Sestrol, these are two pillars of hypertension treatment. First line often.
Right. Super common. But they work differently, don't they? What should someone understand about the differences and maybe the big watch-outs for each, beyond just, the usual side effects?
Great question. Yeah, both lower blood pressure, but different mechanisms, different quirks. Let's take amlodipine first.
Okay.
Very effective, but patients often report ankle swelling. It's really common and usually gets worse with higher doses. Headaches, too.
Right.
But here's a less obvious one we think about. Amlodipine relaxes smooth muscle,
Okay.
which is great for blood vessels, but it can also relax the muscle at the bottom of your esophagus. So it can actually make heartburn worse.
So if you already have GERD.
Exactly. We might steer clear of amlodipine in that case. It's one of those nuanced things.
Interesting. Okay, what about lisinopril then? That's an ACE inhibitor, right?
That's right. Angiotensin-converting enzyme inhibitor. And lisinopril, well, it does more than just lower blood pressure. Yeah, it has broader benefits. It's been shown to actually improve mortality rates in people with heart failure or after a recent heart attack.
Oh, okay.
And another big plus, it's kidney protective. It can help slow down chronic kidney disease, especially in people with diabetes.
So real organ protection there.
Yeah.
But what about the downsides? What are the key warnings for lisinopril?
Exactly. That organ protection is significant. But yeah, it comes with its own list. The ACE cough is almost legendary.
Oh, I've heard about that.
Yeah, it's this dry, hacking cough that just drives patients nuts. If that happens, switching to a similar drug class, an ARB, often solves it.
Okay.
Then there's hyperkalemia, high potassium, so you got to monitor potassium levels.
Right.
And connecting to the bigger picture, there's a rare but serious risk called angioedema.
What's that?
Sudden swelling, usually face, lips, throat, can be dangerous. And the weird thing, it can pop up years after you started the medication.
Years later. Wow.
Yep. And it's a definite no-go if you have narrowing in the arteries to both kidneys. That's bilateral renal artery stenosis.
Okay.
One last thing on lisinopril. Your kidney function creatinine level might bump up a bit when you start. Usually like 20–30% is okay, it stabilizes. But if it jumps 30% or more from your baseline, that's a red flag. Time to stop the med.
That's a really clear distinction, what's expected versus what's alarming.
Okay, let's pivot to diabetes. Metformin. Often the first thing prescribed for type 2 diabetes.
The go-to.
Super effective, but what about like long-term implications or things people might not know?
Right, exactly where we need to look. Metformin is, well, it's famous for causing GI upset, isn't it? Nausea, diarrhea.
Oh, yeah.
The usual trick is start low, go slow with the dose. Or sometimes switching to the extended release version helps smooth things out.
Okay.
But long term, it's really important to know it can cause vitamin B12 deficiency over time. Needs monitoring.
B12, interesting.
Yeah. And the most critical warning really is about kidney function. If your eGFR, that's the measure of kidney function, drops below 30, you have to stop metformin.
What's that? Because of a rare but very serious risk of something called lactic acidosis. Especially risky with really poor kidney function, low oxygen levels, or advanced heart failure. Big safety point there.
So keeping tabs on kidney function is absolutely vital with metformin.
Okay.
Let's switch gears again. Infections and inflammation.
Right.
Two antibiotics everyone's probably heard of, amoxicillin and azithromycin. Amoxicillin's a real workhorse, right? First choice for ear infections, strep throat, basic pneumonia in healthy adults, sinus infections.
Absolutely. And sometimes, if the infection is a bit tougher, maybe caused by bacteria that have learned to fight back, we use amoxicillin combined with something called clavulanate. You might know it as Augmentin.
Oh, right, Augment.
Yeah, the clavulanate basically helps the amoxicillin overcome the bacteria's defenses. Useful for, say, recurrent sinus infections, or if plain amoxicillin isn't cutting it after a couple of days.
Gotcha. And then azithromycin, the Z-Pack.
Still very important. It's first line for pertussis whooping cough. And it's a key backup for strep throat if you have a serious penicillin allergy. But, and this is important, the guidelines have shifted a bit.
How so?
Well, it's generally not considered first line for pneumonia anymore unless you're in an area where bacterial resistance is known to be low. Shows how things evolve.
Right. Guidelines change. What are the main pearls for azithromycin then?
Key thing. Risk of QT prolongation.
Okay. What does that mean exactly?
Think of your heart's electrical rhythm. QT prolongation stretches out one part of the cycle. In rare cases, it can lead to dangerous irregular heartbeats.
So caution needed.
Definitely. Avoid it if you're taking other drugs that also prolong the QT interval, certain other antibiotics like fluoroquinolones, or even some SSRIs. And common side effects, diarrhea and nausea, are pretty frequent.
Good to know. Okay, let's talk prednisone.
Ah, the steroid.
Yeah, this corticosteroid has such broad uses. Short bursts for things like bad poison ivy, gout flares, but also longer courses for autoimmune conditions, rheumatic diseases. It knocks down inflammation like crazy, but what are the absolute critical things listeners need to know?
Prednisone.
Yeah.
Yeah, it's powerful but needs respect. A real double-edged sword.
Right.
The absolute crucial instruction. If you're on it for more than, say, 10 to 14 days, you must taper off gradually. Don't just stop.
Why is tapering so important?
Because the prednisone suppresses your body's own steroid production. Your adrenal glands basically go to sleep. They need time to wake back up slowly as you reduce the dose. Stopping suddenly can cause serious problems.
Okay. Vital advice and side effects.
Oh, they're pretty wide-ranging and common. High blood sugar, hyperglycemia, increased the blood pressure, trouble sleeping, mood swings.
Yeah, the mood swings can be intense.
They can. It also temporarily weakens your immune system, reversible immunosuppression.
Yeah.
And a specific worry in kids is that it can suppress their growth.
Wow, lots to consider there. Okay, moving on. Balancing hormones, taming the gut. Let's start with levothyroxine, Synthroid. The main treatment for hypothyroidism, underactive thyroid. What do people need to know about taking this often daily medication?
Right, often lifelong. So getting it right is key. The dosing is pretty specific based on body weight.
Okay.
But the most crucial instruction for you, the listener, take it on an empty stomach, really important, like 30 to 60 minutes before food or other meds.
Why before food?
For best absorption, food can interfere. And after any dose change, you need your TSH level checked again in about 6 to 8 weeks to make sure it's right.
Makes sense.
Oh, and for older folks or people with heart conditions, the rule is start low and go slow with the dose. Don't want to stress the heart.
Good point. Okay, next, omeprazole, Prilosec.
The PPI.
Yeah, proton pump inhibitor, reduces stomach acid. Used for GERD, ulcers, part of H. pylori treatment. There's a timing tip here too, right?
Yeah.
Best taken before the first meal.
Yeah, about 30 minutes before works best for shutting down those acid pumps before they get going. But
Yeah.
for a drug this common, what often gets missed are the long-term risks.
Ah, okay. What are those?
Well, long-term use is linked to things like B12 deficiency, again, an increased risk of osteoporosis, so bone health is a concern, and also a higher risk of getting C. diff infections. That's a nasty gut infection.
Okay, so not necessarily benign long-term.
Not entirely, and because of these risks, and because your stomach can actually start overproducing acid if you stop suddenly.
Oh, rebound.
Exactly, rebound acid hypersecretion. So if you've been on it a while, it's best to taper off gradually, not just quit cold turkey.
Right.
And it's also on the Beers list if used for over 8 weeks. That's a list flagging meds needing extra caution in older adults.
Good to know. Definitely shouldn't just stay on it forever without talking to your doctor.
Correct. Needs periodic review.
Okay, finally, let's touch on mental well-being. We'll finish with sertraline or Zoloft.
An SSRI.
Right. Selective serotonin reuptake inhibitor. First line for really common conditions. Anxiety, depression, PTSD. What are the key things for patients to expect, and what are the critical safety points?
Well, first off, patience is key. As you said, it really takes 4 to 6 weeks to feel the full benefit. It's not instant.
Important expectation to set.
Absolutely. And safety-wise, there are some crucial prescriber pearls. We always assess for any increase in suicidal thoughts, especially when starting or changing doses, particularly in younger people.
Okay, vital check.
And it's super important to screen for bipolar disorder before starting. Why? Because giving an SSRI to someone with undiagnosed bipolar can actually trigger a manic episode.
Wow, okay. Didn't know that.
Yeah, it's a critical screening point. We also watch for something called serotonin syndrome signs like muscle stiffness, really jumpy reflexes, agitation, fever. Rare, but serious.
Right.
And one absolute no-no, sertraline cannot be taken with MAOIs. Those are another older class of antidepressants. The interaction risk is severe, potentially life-threatening.
Okay, crystal clear on that. Wow. We've really covered a lot of ground there.
We have.
Just those 10 common meds, statins, blood pressure drugs, antibiotics, steroids, thyroid, PPIs, SSRIs.
Yeah.
It really shows how much there is to know beyond just the name, doesn't it?
It really does. So what does this all boil down to for you, the listener?
Yeah.
It means understanding these prescriber pearls, the side effects, the interactions, the long-term stuff. It isn't just, doctor speak.
Right.
It's for you. It helps you be an active player in your own healthcare. Ask smarter questions. Be a better partner with your doctor.
Moving beyond just taking the pill to understanding it.
Exactly. Understanding what it does, how it interacts with your body, and what you need to look out for. It's about empowerment.
Absolutely. So building on all that, all those details about interactions, maybe long-term risks, or even just remembering to take something on an empty stomach, how might you, listening now, prepare for your next doctor's visit? If you get a new prescription, or even talk about one you've been on for years, now that you have this maybe enhanced understanding, what questions might you ask differently this time? Something to think about.
It's definitely something to consider.
We hope this deep dive was helpful. We'll catch you next time.